Hello, my name is Mary Tocco, independent vaccine investigator for the last 29 years, and international public speaker on the risks of vaccinations.
And I'm Dr. Renee Tocco, founder of the American Chiropractic Autism Board and Hope for Autism. We are here today to discuss the impending swine flu federal mandate orchestrated by the World Health Organization that states that all people must get the swine flu vaccine this fall. The Obama administration is working to implement many of the steps recommended in the 68-page report from the President's Council of Advisors on Science and Technology. The Council recommended that manufacturers begin packaging bulk vaccine into vials and syringes immediately so that some could be available in September for those at high risk, rather than awaiting the results of studies underway to settle dosing and other questions. The government already has asked all 5 manufacturers to bottle its doses as soon as they're ready to assure the earliest possible availability. Does this sound like a government that makes safety the highest priority? Is vaccine safety even a concern?
But we've all heard that history repeats itself. You may know that the last national swine flu vaccine program in 1976 left 25 people dead and thousands injured. A large cost to pay considering one person died from the actual swine flu. The vaccine program was pulled and considered a disaster. For information, see Congressman Dr. Ron Paul on YouTube, where he calls for the government to get out of public health management. With all of the hysteria in the media, it's sometimes hard to keep the reasonable perspective. Keep these facts in mind. Worldwide, there have only been 1,462 deaths out of over 177,000 cases of swine flu. In the United States, over 27,000 cases have resulted in 127 deaths. Every death is a tragedy, but such a low death rate should not be the basis of a communistic government policy. Maybe you recall that the Centers for Disease Control, with the help of the media, consistently tell us that 36,000 people die from the flu each year, a figure that has been shown to be a lie. But in this case, we are talking about less than 1,500 deaths for the entire world.
And it really speaks louder than words when it's not only citizens that are very leery of the vaccine. In the UK, a survey published in Healthcare Republic reported that up to 60% of general practitioners may decline vaccination. Within the same week, a survey was published by Nursing Times, which found that a third of 1,500 nurses would refuse the vaccination as well. But a more important survey has yet to be conducted. Will these same doctors and nurses be willing to inject you and your family? I'm afraid it's confirmed our government won't protect us, and the medical community has not taken a stance. So that only leaves us to become educated and take action to protect ourselves. There are many concerns about this experimental swine flu vaccine.
Consider these facts. Common flu vaccine ingredients include egg protein. Many are allergic to eggs. Formaldehyde, used in vaccines as a tissue fixative and is considered a hazardous compound and is a vapor toxic. Polysorbate 80 is shown to cause infertility in mice. Sodium chloride, calcium chloride.
Monosodium glutamate, or MSG, is a dangerous excitotoxin. There have been numerous studies showing a large percentage of the population may have allergies to MSG. MSG has been blamed for causing a wide variety of symptoms and ailments such as migraines, nausea, obesity, digestive upsets, drowsiness, heart palpitation, hair loss, asthma, anaphylactic shock, diabetes, and many others. Potassium phosphate, a soluble salt which is used as a fertilizer, a food additive, and a fungicide. Thimerosal, a form of ethyl mercury which is toxic in parts per million and has been linked by many researchers to autism.
Squalene is an oil-based adjuvant that has never been approved in the United States as safe. It can cause blindness, autoimmune disease, and can inhibit sperm production. More than 24 peer-reviewed scientific papers from 10 different laboratories throughout the United States, Europe, Asia, and Australia have been published documenting the development of autoimmune disease in animals tested with squalene. Other studies with squalene have had deadly outcomes. A study on guinea pigs found that when they were injected with this special adjuvant, only 1 animal survived. A repeat of the study found the same outcome. In addition to mercury, there is squalene in at least 2 of the H1N1 vaccines. Many vaccines are now developed on human diploid tissue. In plain English, This is organs and tissues from aborted babies. In addition to a moral and informed consent issue, we also have serious public safety issues to consider. The safety of injecting our children with aborted human fetal DNA has been debated for over 40 years, but has never been studied. Injecting aborted fetal DNA into our children brings up many safety concerns. First, there is a risk of autoimmune disease triggered by our children's immune system, recognizing the contaminating DNA and generating antibodies that will also recognize their own similar DNA. It is even possible for insertion of the DNA into our children's own genome. This has been linked to cancer, but has never apparently warranted even one safety study. Vaccines currently developed on aborted tissue include the MMR, rubella, hepatitis A, and now the flu vaccines. The CDC and the government has stated that this is a new virus, which is not true. Fluvarin, made by Sharon, licensed in 2006, and Flumist by MedImmune, licensed in 2007, both contained H1N1. Go to www.novaccine.com for a complete list of vaccines and ingredients.
The Center for Disease Control reports that the symptoms of H1N1 flu virus are similar to the symptoms of seasonal flu and include fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, and fatigue. A significant number of people who have been infected with this virus also have reported diarrhea and vomiting. Also, like seasonal flu, severe illness and death has occurred as a result of illness associated with this virus. But it is usually people who are not well to begin with who die from complications of the flu. There are high-risk or compromised groups of people, and how ironic is it that they're the first in line in the plans for administering this controversial, never-tested vaccine. Drug companies were given billions of tax dollars by the United States to develop experimental flu vaccines last year. Among these companies is Baxter, a company that released a contaminated flu vaccine to 18 countries in February. The World Health Organization discovered that these vaccines were contaminated with the live avian virus and said these vaccines could have potentially caused many deaths. Within 1 month, the WHO reported an outbreak in Mexico, calling it the swine flu. Now, the CDC is saying that this new virus is a combination of the bird, swine, and human virus. No one has yet to explain how this new virus came about.
The CDC is recommending that all people take 2 regular flu vaccines and 1 H1N1 swine vaccine this year. Giving multiple flu vaccines has never been tested for safety and